morning, gentlemen. Today we have a community service organisation that's getting its word out into the community and all over Victoria. I'm not sure if it extends beyond Victoria, but they've been to many groups, and I think it's a very important community service. Now, our speakers today are Anna Masiti and Ray Kelly. Anna works as a service improvement facilitator with the North Eastern Melbourne Integrated Cancer Service, that's NEMICS, and has been with the team since 2007. Anna's areas of specific responsibility are managing the initiatives relating to improving the coordination of cancer care and the consumer participation projects that seek to improve the health literacy of people affected by cancer. Ray, who's also speaking today, has been a consumer representative with NEMICS since 2013, and as part of that role he contributes the consumer perspective on issues that need improving and advocates for the concerns of those affected by cancer, including patients, their families and carers. As well as this, he is a consumer representative on various other steering committees with Austin Health and the Victorian Comprehensive Cancer Centre. He is a semi-retired managing director of an employee relations consultancy firm. He is also the past president, current secretary, public officer and lifetime member of Greenwood Combined Probus Club. That's an interesting connection with our organisation. As a community ambassador with NEMICS, Ray shares his personal and family experiences of cancer and hopes to equip those and others on how to access cancer information and support. I welcome both Anna and Ray.
Good morning, everyone. Thank you, Gary, Bruno, who's absent, and Don, and all of you for inviting us to come along today. As mentioned, I work as a service improvement facilitator with this organisation known as NEMICS. Our presentation, titled Coping with Cancer, What to Know and Where to Get Help, hopes to provide you with some useful tips and information on the sorts of help that's available to assist if either yourself or someone you know is diagnosed and or living with cancer. This presentation has actually been developed and put together by a group of people who have had personal experience of cancer and know firsthand just how difficult it can sometimes be to get the right information at the right time or to find the right support when you're actually going through such a difficult and confronting time. I'll just talk about what the presentation will and won't cover. So firstly, we're going to just talk a little bit about the role and purpose of the integrated cancer services in Victoria and specifically NEMICS. Some information and support that's available at the different phases of cancer care, and finally information on where and how you can find out more. What we won't be speaking about is specific cancer types or specific treatment types or particular specialists and so on, so just so that you know that up front. So in Victoria in 2003, the Victorian government undertook a major review of cancer services in our state. The reason that this was done was for a number of reasons, primarily because there's obviously a recognition that we are an ageing population and with that comes an increasing incidence of cancer. Additionally, cancer comes at a significant cost to individuals, families and the community. There is also increasing complexity and cost associated with diagnosing and treating cancer. So the government felt it was particularly important to direct funds and initiatives and supports to really look at how we could drive change and improvements in both the provision of cancer care and the outcomes from it. And in undertaking this reform, the government identified a number of necessary changes, one of which was to establish the integrated cancer services, of which there are 9 across Victoria, covering both metropolitan and regional areas. 8 of these cover a geographical region, as outlined on the slide, and the 9th is a specific integrated cancer service that addresses the needs of the paediatric population, children, babies and young adolescents. All the integrated cancer services are tasked with this, core agenda to improve the planning and delivery and outcomes of cancer care. And the way in which they do that is by engaging with primarily doctors, nurses, administrators, managers, CEOs, but of course, obviously people who actually have cancer. The integrated cancer services are funded by the state government and specifically the Department of Health and Human Services. More locally, the integrated cancer service that covers this region, which we are today, is this northeastern metropolitan Melbourne integrated cancer service. This region has a population of about 1.34 million people, and in 2014 there were over 7,100 new cases of cancer diagnosed. The way in which NEMICS works is it has formal partnerships with 4 core members, of which are the public health services in this region, and they are on the slide in green: Eastern Health, Northern Health, Austin Health and Mercy Hospital for Women. However, we know very much from perhaps your own experience, and I know certainly from mine, that cancer doesn't just happen in hospitals, and the treatment and care doesn't just happen in hospitals, but in fact it might start at your GP, the investigations might start at a GP. There are diagnostic services undertaking CTs and MRIs, there are screening services, there are private hospitals that provide a lot of cancer care or in conjunction with public hospitals, as well as that people post cancer treatment often might require rehabilitation services or community health services. So what the integrated cancer services are essentially trying to do is form formal partnerships with all the service providers of cancer care in a region to really try and provide a consistency of good care, a consistency of standard and good outcomes ultimately. So that's the core agenda, to improve quality and outcomes of cancer care. And the way in which they do this is by working with this variety of providers in a region to share resources, to provide grant funding, to provide education support, to really make sure that the region works together, not just individual hospitals, but the whole region works together, so that irrespective of whether you present at Northern Health or Eastern Health in perhaps Box Hill Hospital, that you would expect to get the same level of support, care and treatment, irrespective of which hospital you might present at. And so essentially the integrated cancer services are a clinical network. That's their core purpose. In addition to, so part of the way in which we do that is to undertake projects and initiatives, support of health services, but of course we don't do that without the very people who actually experience cancer care, and we engage a lot within NEMICS with consumers or families, patients, carers of people having cancer care or having had cancer care, because we understand that obviously that's the best way to improve a service, to speak to the people who have sat in a chemo chair for several hours, or to a family who has to wait to receive a diagnosis and the anxiety that comes with that. And in 2011 at NEMICS we established a formal way of getting consumer input and advice to a lot of our projects, and we established our consumer reference group. On the slide is a photo of some of the members of our group. It's actually a bigger group than that, but you see Ray, who's presenting shortly, in amongst the ladies there. And this group is a group of people whom all have had a personal experience of cancer, either directly or as a family or carer support person. But they're also a group of people who are very passionate about improving services and making sure all those cancer care providers on the previous slide are doing the best by patients and recognising what core things are important in a patient's experience. Each of the members on our group also sit on other committees and projects and so on to consistently remind clinicians or doctors, nurses about what's important to patients, the patient perspective. And speaking to community groups as we are today was one of the very projects that this consumer reference group actually felt was really important. They wanted to ensure that the learnings that they have gained from having gone through cancer or going still through cancer care is something that they could impart to other people who might not know or not have experienced this just yet. We've got a variety of different brochures and bits and pieces that you might want to take away, but this particular little brochure is a little bit about the work that NEMICS does, and specifically the Consumer Reference Group. And if anyone is interested or passionate in being involved with us, feel free to have a chat with me later or pick up one of these and contact me when it suits. Ray Kelly has been a very active member of our Consumer Reference Group since 2013 and provides many hours volunteering a lot of his time to our projects and does work with us as a community ambassador as he is today. So I will now like to hand over to Ray, who's going to share some of his own personal story and the tips and experiences that he's learnt along the way. So I hope you find it useful. Thank you.
Thank you, Anna, and thank you, Probians, for having us here today. The topic, as Anna has said, that we're speaking of, unfortunately, is one that a lot of people are reluctant to openly discuss and talk about. Believe me, cancer is not contagious if you talk about it, and anybody who shook hands with me prior to the meeting starting won't catch any of the cancers that I've had. I can guarantee you that. A number of us have, unfortunately, know somebody who has had some form of cancer and have not survived through the process. And that leaves a scar on our memories, and I'm sure that there's quite a few of us in that situation. Fortunately, though, there are numerous people who have some form of cancer and they've lived through it and with it. As Anna has said, we're here today to raise awareness of the help and the support that's available for people who've had cancer, for their carers and their family. A lot of information that we give today is equally relevant to any other major medical condition. So if some of the information that we give you can use for any other medical conditions. Now, questions, you can either ask them as you think of them or at the end of my presentation. I find when we have a guest speaker at my probus, if I think of a question in the first 5 minutes, if I don't write it down, I've forgotten it by the end of it. So just ask questions as you feel. Now, Ray's story. My first encounter with cancer was at the age of 12 years. A close schoolfriend of mine at Scottsburn State School number 2176 unfortunately passed away with lung cancer at the age of 12. Neither of us smoked, and we certainly had no reason for him to have lung cancer, but he did. Anybody here know where Scottsburn is? No? Oh, well, we take these and put them away for the next session. There was a prize if you knew the answer to that. My next encounter with cancer, not counting various small skin cancers, but the next major one, was 20 years ago this year. I had an ulcer in my mouth. I went along to a specialist, and he examined me, looked me in the eye and said, "You have mouth cancer." And I looked him back in the eye and said, "Well, you found it, you better fix it." And they did. 14 and a half hours in the operating theatre, and here I am today speaking about it. My mother and her two sisters at the age of 85 all passed away because of bowel cancer. So when I was around about 50, 55, I'm not sure how old I was, but the state government sent out bowel cancer kits to people in that age group. And I received mine, and I thought, well, I better do this because of my family involvement and history of cancer. I did that, and I received a letter back that said, "You better go and see your GP." So off to the GP, he sent me off to a specialist to have a colonoscopy. So I was there with the specialist who's doing the colonoscopy, and he said, "You were supposed to come back to me 10 years ago about your esophagus." He said back then he'd done gastroscopy, and apparently there was some problem with my esophagus. He said, "So what I'll do," he said, "I'll do both. I'll do a colonoscopy and a gastroscopy while I've got you." So I said, "Well, make sure you do the gastroscopy first." So he did everything and came back and said, "Yes, you've got some polyps, so we'll clean them up." And he said, believe it or not, he said, if we hadn't have got them, he said, when you were 85, you would have died of bowel cancer. It takes 30 years for those polyps to turn cancerous enough to kill you. Of course, my mother and her sisters, in the time they lived, there was no such thing as colonoscopies and x-rays to look at all those things, so they didn't know they had those polyps, but we do. However, he said, more importantly, he said, "I've made an appointment for you to see an esophageal specialist." This was on Friday, on Monday morning at 9 a.m. So I go along to this esophageal guy, and he said, "You've got cancer of the esophagus. We're going to have to remove your esophagus." So I said, "Well, that's okay. I'm going on 3 weeks holiday, so we'll do it when I come back." And he said, "Now, if you go on 3 weeks holiday, we won't be doing it at all." He said, "You've got 10 days before it breaks through the esophagus wall into the stomach," and he said, "That'll be the end of you." So I guess he didn't go on holidays. Now, that was approximately 11 years ago. Now, I've lost a number of friends, the same as a lot of us have, with various cancer forms over the years, and I've had a lot of little bits cut off my skin, being fair. I don't take too well to the sun. However, about 3 years ago, my PSA reading, and we all have PSA tests, don't we, gents? Yes, of course, everyone's nodding. It shot through the roof, and they sent me off to a specialist regarding that. And after biopsies, he said, "Yes, you have prostate cancer." He said, "But you will most likely die with it, not of it." So here I am today, still here with all of that going on. Now, the consumer reference group that Anna spoke of has designed a book or a folder called My Cancer Care Record. I'll be referring to it occasionally during my talk, so I'll give out a couple of copies and pass them around. And that came about because we believed that the consumer reference group, that there wasn't enough being done to record all your information on. Like cancer in Victoria, now on this slide we provided some statistical information, and I'll let you digest that. Point 1 is actually not 30,000, 29,738 people were diagnosed with cancer. and 11,000 died from cancer. Point 2 is at the age of 85, at least 1 in 2 men and 1 in 3 women will have been diagnosed with cancer at some stage of their life. Now this includes, of course, harmless skin cancers as well. But the statistic there, men, is 1 in 2 of us is against 1 in 3 women. Now the most common cancers are prostate, breast, bowel, lung and melanoma. Now cancer is not all doom and gloom. Thanks to early detection of cancer through various screening programs, plus the major improvements in treatment, more and more people today are living through the cancer processes. Now in 2012, 67% of all Victorians were alive 5 years after diagnosis. Now this is a 20% increase from 1988. So that's a massive increase in a few short years. Now, as I said, the statistics are 2012. I'd like to see what the statistics are today. Now, what information and support is available and why is this important? Well, as we all know, it can be a very daunting and difficult time when we're ill because we're worried and we're anxious about our condition. In these periods, it can be time-consuming and tiring, attempting to find out information and support that could help us. Being more informed and better supported can help lessen the impact of treatment side effects. It assists people to have more knowledge about their disease, the treatment and available supports that are there. It also assists with better adherence to treatment. People understand why things are important. We understand that knowing what is available to support you or your loved one through this time can be difficult to find out. The old saying, you don't know what you don't know. Now there is support available to assist people with cancer, and I hope that the information we provide in the next few slides will assist you or someone you know to seek support that's required if necessary. Now, what people have said, in an effort to find out what aspects of cancer care needed to be improved, NEMICS conducted a series of consultations with people who had had direct experience of cancer. Now, these are a small sample of the quotes given by the people consulted. I'll not read them, but give you some time to just read through them yourselves. Now, from these quotes, we can see that some of the issues people are identifying include difficulty in finding out what supports and services are available, the importance of knowing right at the beginning what your options are and what questions to ask. Now, the information obtained from these consultations led NEMICS to commencing these information sessions to help raise awareness of the issues that people may face if they're diagnosed with cancer and how they might overcome them or indeed prevent them from occurring. Now, Kermit always thought he was a frog, and he got a shock when he found out he wasn't. Now, studies indicate that some patients only remember 10% of what they were told during a consultation because, like Kermit, when they find out there's something drastically wrong, they go into shock. Now, face-to-face communication is enhanced with the provision of good quality written information that the patient and their families can return to in their own time, or even a recording of the conversation that you've had with the clinician. Now, the My Cancer Care record that is going around is a great way to record all of that information and keep it in one's place for future reference. Now, some tips when attending medical appointments. Where possible, it's good to be prepared for your medical appointments. If you know that the discussions you are having to have with your doctor may be distressing, always take someone along with you. They can assist you in understanding the information that has been given to you during that time. Prepare any questions ahead of the appointment and don't be afraid to ask questions. It is no good walking out of the consultant's room and saying, oh, I wish I had have asked that question, and then worrying about it. It's a great idea to bring a list of medications you are on and a list of your medical problems and your family history. This information is frequently requested by healthcare professionals, and it is not always easy to remember on the spot. Now, the My Cancer Care record has sections in it for all of that type of information. Now, ask your doctor if you can record the conversation. A lot of doctors don't mind that. Have the doctor show you a diagram. It's a lot easier to see a diagram of what is wrong than to sit there and try to fathom out the words. And I was involved in a project with NEMICS giving out grants not long ago, and one of them was for a section at Austin who are putting together 3D images of the parts of us where we've got the illness, not just for cancer but for other things as well. So that you'll have a 3D model. If it's your heart, you'll have a 3D model of your heart and the doctor can show you there. So it's a great idea to ask for a diagram. Ask for written information or reputable websites that you can go to where you and your family can refer to them for further information. Ask how you can contact the medical people if you think of questions later. Some doctors will go as far as providing their mobile phone numbers or their email addresses so that you can contact them later. And always, once, if you get one, take that My Cancer Care record with you to every consultation. Now, tips during the initial investigations into your problems. The need for information starts right at the beginning of the cancer experience. At the time of initial investigations, that is, when tests are being conducted and the doctors or the team are establishing the cause of your illness or symptoms, it is good to ask questions and also inform the medical staff of relevant information. Ask why certain tests or investigations are being done. Ask to see the results and have them explained to you. Quite often we don't worry about the results. Find out what the main problem is and what needs to happen next. Now, don't be afraid to speak up and inform the doctor or the medical staff of what is worrying you, of things that you have noticed about your own body, what feels different, what might have changed recently, and any relevant family history. No one knows your body better than you. So share whatever's worrying you, because what you might have noticed, even as small as it may be, may make a difference. Because this sort of information is very useful for the doctors. It helps them determine the possible causes of the illness or other symptoms. Now, the Cancer Council of Victoria has produced questions to ask your doctor. Now, there's some of these down the back table, so I urge each of you to take one of these with you. If you take nothing else, take one of these.
Can I just add something to that? I'm a doctor and a child doctor myself. One of the things about people telling doctors what's going on is I could fill a book with people as a parting remark, might say something, which will suddenly ring a bell.
Yes.
And what they came in about was insignificant. What they had is a major issue.
Yeah.
But yeah, it's surprising how many times that happens.
Yes, and that's why we should always be prepared, and as I said, make sure that you tell the medical staff what you're feeling, what's wrong with you. Now, tips at the time of diagnosis. In most cases, a discussion with your GP will start the ball rolling in relation to the type of specialist you may need to see and whether to be seen in a public or a private setting. Knowing what the implications of this decision will be in terms of waiting times, cost and support services is difficult for you to predict. However, it is important to ask these questions of your GP. Often you can take some time to make these decisions and undertake some research of your own. Ask around among the people that you know, ring your health insurance provider as to what they provide, and research on the internet, but only on reputable sites. Now, it is appropriate to ask for a second opinion if that feels right. You have rights and choices, and ultimately, you are the one in charge of your health. So if you're not really happy with what's going on or confident, ask to see someone else. I can tell the story of someone who approached me a while back after a talk like this, and he said, "I wish I had have heard your talk, Ray, 18 months ago." His wife was suffering from reflux. He was taken her to the GP they'd been going to for 30 years or so. And after 12 months, he said to the GP, "I want to go and see someone else. My wife has still got the same problems." He went and seen somebody else, and she had cancer of the esophagus. And unfortunately, she passed away. He said he did not want to go against the GP because he'd known him for 30 years, always trusted him, but apparently the GP just missed something small. I don't know the full story, but remember, you always have the right to ask for a second opinion. When seeing a specialist, obtain information on the specific cancer type, what treatment options exist, and the likely side effects. Because for some cancers there are multiple ways of dealing with it. Let your doctors know that you would like a copy of all test results, treatment information, letters and discharge summaries. You are entitled to all this information. It is your information. Cancer care can involve being seen by a number of doctors. Information does not always flow smoothly or promptly between the different doctors. It is therefore important that patients and their family members keep up-to-date records of their medical information, medication, treatment-related information, and that these are taken to all your appointments so that they are quickly on hand if they're required. And again, all of that can be put into that folder that's going around. Now, treatment planning, multidisciplinary cancer care, is an integral part of good cancer care. It basically means groups of health professionals working together, providing the different expertise, services and support that cancer patients may need. It is considered best practice that these teams meet together on a regular basis to discuss, plan and decide on the best form of treatment for any patient suspected or diagnosed with cancer. Now, these meetings are called cancer multidisciplinary meetings. Now, there are many people involved in treating a person with cancer, and a typical list of who would attend a multidisciplinary meeting is on the screen. I won't run through those. Now, the multidisciplinary meeting is an opportunity for all these people to get together to review their test results, determine the type and the stage of the cancer, and then work out the best treatment for each individual person. Many minds are always better than one. Now, people with cancer should expect to have their treatment discussed and planned at a multidisciplinary meeting. If you or anyone you know is having treatment and they aren't informed of the multidisciplinary meeting, ask your medical specialist and find out what the outcomes of those meetings are. Now, listed on the overhead and also in handouts going down the back There is a website that lists the multidisciplinary meetings within Victoria and the specialists who attended. Now that is a photo of a typical multidisciplinary meeting. All the clinicians are sitting around looking at the screen, and over on the right hand side are those doing diagnostics, and tests such as PET scans and pathology slides are displayed on large screens at the front of the room, and they're easily seen by all attendees. Now, following presentation of the patient's details, the diagnosis and the stage of the cancer are determined, and a treatment plan is then developed by all of them. Following the meeting, treatment plans are discussed with individual patients, and a final treatment is then determined. Copies of recommendations are also often sent to the GP. Now, multidisciplinary care enables high-quality treatment and is endorsed in Australia and overseas as best practice in cancer care. Now, tips beyond the medical needs. Cancer can interrupt the normal flow of our life and bring with it other challenges, such as social, practical, emotional and physical concerns. Now, the main concerns are listed on the slide, and they are social, practical, physical, emotional. Now, one of the physical changes that had happened to me was after my esophagus was removed. Because I had had so much treatment over a period of time and so many doses of anaesthetic, and for long periods, I was urged by the specialist not to drive for some months after the operation. He said what will happen because of the amount of anaesthetic I'd had over a period of time, not just for my mouth, following up with dental and all such things, and then the esophagus, that I would have short relapses of memory. In other words, I'd be sitting there watching the football, watching Collingwood play Carlton, and Collingwood were 2 points down and they were about to kick a goal, and I unfortunately would have one of my relapses, and when I woke up I found that Collingwood had won by 4 points, which is natural of course. However, he put it another way. He said you'll be driving your car and 150 metres up the road will be a school crossing. There'll be nobody on it. You'll have one of these relapses and you'll have wiped out 20 school kids when you go through the school crossing. I definitely did not drive, believe me. Tips during treatment. Now, during treatment, as your treatment progresses, different issues and support needs may arise. For example, there are physical symptoms such as pain, fatigue and nausea. Knowing what is a reasonable level of symptoms to expect and who to report symptoms to can assist you to be in control of your own health. Speaking to the health professionals is helpful as they can assist with strategies and medications to help lessen or manage the symptom. Now again, when I went in for the esophagus problem, there was a physiotherapist who seen me the night before just to run me through a few things and make sure I was fit and well for the next day. And she said to me, Ray, when you come out of the operating theatre and finally out of ICU and wake up, she said, you'll be feeling reasonably fit. She said, day 2 though, you'll get the worst pain you've ever had in your life. So off I go, have the operation, come out. Day 1 I'm fairly good, thought I was clever. Day 2, morning, I'm as good as gold. I had visitors, and about 2 o'clock in the afternoon, the worst pain I've ever had kicked in. But instead of panicking, I knew, because I was already told that that was going to happen, I just pressed the buzzer, the medical staff come in, gave me a dose of morphine, I saw things floating across the ceiling, and the pain went away, but I never panicked because I knew it was there. So if you get to know what the symptoms to expect are, it helps you. Now, there's social and practical issues such as financial concerns, difficulty attending to housework, strain on relationships and social networks, getting time off work or study if you're a student, or getting back to work or study. Now, there are social workers and other allied health staff who can assist with all types of social, practical and financial issues. Their local councils can also provide help. Cancer Council Victoria also provides a financial and legal advice service, which is quite handy. Now, the emotional and psychological issues, the stress is natural or an expected response to any life-threatening illness, and it is experienced by all cancer patients, their family and friends to some degree. Help is available and it is important to ask for it. If you don't ask for the help, you only get worse. Now, relevant support staff that can assist with such issues include people like social workers, psychologists and counsellors. There are staff available within most cancer centres, but they're also accessible via community health centres, privately and also through your own GP. Now, a lot of people don't realise, but there are Medicare rebates available for counselling by registered psychologists under the Australian Government's Better Access to Mental Health Care initiative. A very close friend of mine had cancer of the jawbone and had a bit taken out some 4 years ago. But he kept it all within himself, and he was starting to have a few psychological issues. And I just happened to say to his wife about the Medicare rebate. So when they were with the doctor, she raised this. He's had 2 sessions with his psychologist. He hasn't had a drink since they'd done the operation because of the tablets he was taking, etc. The first thing the psychologist said to him, I think you better go home and have a beer and relax. He's a different man now after having 2 sessions with this psychologist. So we don't all know about the Medicare rebates that are available. Now, the complementary therapies such as yoga, massage, art therapy can also be valuable in aiding people to work through these issues. And don't forget the support that's provided through our local community groups, church groups and social groups such as this one. We have done a couple of talks to men's sheds, and to hear those men and the support that they get through that is phenomenal. Now, this is one of my favourite ones. I tried that out with an anaesthetist once, but it didn't work. He kept sending the bills. Now, there's a quote from a carer, and I'll just read it. Looking back, and in hindsight, I think counselling would have been really helpful, not only for myself and my wife, but also for our children. I believe that if we all had counselling the whole way through and at the end, this may have made things a little easier at the time and now years down the track. Now, the key point that we're trying to make at this time is you don't have to suffer alone. Having the right information and support can help to reduce stress and anxiety. There are services available via your GP, the hospitals, local community centres and councils. All you have to do is ask. Don't forget about the Cancer Council Victoria. They have an information and support service, and they're a great resource for information ranging from cancer type, treatment options and support that's available in your local area. In addition, the Cancer Council Information and Support Service is staffed by trained nurses and with many years' experience. Now, this is not support, but I got a lot of support when I was having radiotherapy treatment for my mouth down at Peter Mac, and I was feeling down. I used to get there 8 o'clock in the morning because they only had 2 machines back in those days, and if one went down, of course you had a long delay, so if you had a 10 o'clock appointment, you probably didn't get in until 2:30 in the afternoon, so I'd get in first. Anyway, one of the machines broke down this morning, and I'm sitting there, and sitting up a little bit further are 2 young people, early mid-20s, with a young baby crawling around, pulling herself up and down on the floor. So I went and spoke to them, and I found out they were from Tasmania, and they were overstaying in Peter Mac in one of the units that are there for people with cancer and their husband or wife can stay with them. So I said to them, "Oh, which one of you are having the treatment?" And they pointed at the little girl. So whenever I felt down from then on during my treatment, I thought of that little girl. She'd be 21, 22 today if she got through it, and I hope she did. And I quite often think of her. Now, tips at the completion of treatment. The time when treatment stops or ends is a significant period in your life. While it might feel good to know that treatment has ended, and it can also be a time of uncertainty as the frequency of contact with doctors and hospitals reduces. You're on your own. New issues or concerns then might occur, such as resuming your family roles, when and how to resume work or school, fears about the cancer coming back, that is a big one, and anxiety related to future checkups. Now, different types of information and support can be required. Asking your doctors or your medical team for a written care plan detailing your cancer, the treatment received, follow-up appointments and or tests, and any specific signs or symptoms to look out for is one very good strategy that can help alleviate some of the anxieties that you may feel at this time. Find out who to contact if something changes. Find out what sorts of things you can do to keep healthy. After I had the mouth done, they had to put it all back from parts of my arm, the floor of my mouth. And they cut my tongue at the time and sewed it back up and things like that. And one of the surgeons said, "I want you to go home and read the newspaper out loud to get your tongue going because you may have a problem ever speaking again." I tried that a couple of times and thought it was stupid. So I'm sitting home on my own because there's no one else in the house, they were all working. So I put on my favourite CDs of Buddy Holly and Elvis and so forth and sing out loud. I went back to the specialist and I walked into his office and he said, "How are you, Ray?" And I said, "I'm okay, how are you?" He suddenly jumped up from behind his desk, went out to the other specialists in this clinic, called them all into his office, and he said, "Now, Ray, how are you?" I said, "I've already told you, I'm all right." And he said, "Well, the reason I asked you and one of these guys to hear is you're not supposed to be talking." So not only was that singing beneficial to my talking, but it also cleared out all the cats, dogs and possums within 3 blocks away. So that specialist now suggests people sing instead of read the paper. Now, there may also be times when joining a support group may be one of the strategies that you may feel is useful, and knowing where and how to contact these groups is very important. Now, the website that's listed on the screen is for the Australian Cancer Survivorship Centre. It includes information on how to optimise health and well-being of cancer survivors and their carers in the post-treatment phase. Now, we have handouts on that service down the back as well. How can I find out more? Now, this list is no way an exhaustive list of cancer information. However, it does provide credible information sources that will provide you with accurate and up-to-date information specific to the Australian context. We have also brought with us handouts for you to take away listing all of these sites and services as well as others. Now, Cancer Council Victoria provides an extensive range of information and support services, and as I previously mentioned, They provide confidential telephone and online information, support and advice. Their service is provided by experienced cancer nurses, and they operate Monday to Friday, 9 to 5, and they're accessible from anywhere in Victoria. They also operate a wig service. They run lots of different workshops and education programs. They provide information and access to free advice services such as financial planning, workplace and legal advice. In addition, they produced a vast amount of written information. All their information can either be found on their website or by calling the support service and asking for hard copies. Now, EviQ has information sheets about cancer treatments and related procedures, primarily used by health professionals when they discuss a person's chemotherapy or radiotherapy cancer treatment. How can I find out more? There are many cancer support groups. There are both face-to-face and online groups for all different cancer types. Now, again, details of the groups that you may want to investigate can be found on the Cancer Council website or by ringing them. Now, the Better Health channel provides health and medical information that is quality assured, reliable, up-to-date, easy to understand, regularly reviewed and locally relevant. Now, in addition to all of these, don't be afraid to ask members of your healthcare team, because they can answer all these questions as well. How can I find out more? There are many organisations that have been established to provide individuals with information and support for specific cancer types. Contact details, including websites and phone numbers where they're available, and a brief description of the service they provide, have been provided on a handout that we have with us today. In conclusion, this presentation is focused on providing you with the information on support available following a diagnosis of cancer. However, whether you've had a cancer diagnosis, are caring for or know someone who has cancer, we should all take advantage of available cancer screening programs. Ask your doctor what screening programs you may be eligible for and how you go about getting screened. Now, such screening programs include Breast Screen Victoria program, which aims to detect early signs of breast cancer in women aged 50 to 74. Now, remember that while men aren't routinely screened, breast cancer can affect us. Very uncommon, but it can happen. Male breast cancer accounts for less than 1% of all breast cancers, and men in this area with this cancer can feel very isolated and stigmatised because it is something that we don't very often talk about. Now, the National Cervical Screening Program aims to detect changes in the cervix that may lead to cervical cancer in women. The National Bowel Screening Program checks for early signs of bowel cancer. This program invites people aged 50 to 74 years old to screen. If detected early, up to 90% of cases can be successfully treated. Here's the bad news. Unfortunately, men, there is a lower participation rate amongst us, and it is a significantly lower participation rate. Finally, try and maintain a healthy lifestyle to reduce your risk of cancer. It is estimated that at least 1/3 of all cancers could be prevented through a healthy lifestyle. Limit alcohol intake, regularly exercise, healthy weight, balanced diet, being sun-smart and not smoking are all ways to help prevent cancer. Smoking is the only reason I had the bottom right-hand side of my mouth removed. I smoked a pipe, Where the end of the pipe went is exactly where the cancer grew. Treatment of cancer continues to improve all the time. Many people are now living longer with cancer, and support is available to help, and we hope that we've provided you with some of this information today. Now, before we wind up, I'd like to let you know that sometimes something good comes from having cancer. You all look at me and say, don't be stupid, right? Well, I had a melanoma on my back and it was detected early. I have regular checkups for that, being fair. And the GP cut it out, sent it away, rang me up and said, you better come in, Ray. I went in, he said, look, I haven't gone deep enough. He said, we need a specialist now to get in deep and get this out. So I said to him, look, what about the bloke who put my mouth back together again? Is he still operating down at Warringal? He said, yeah, he's still there. So I went down and seen this guy, and I'm sitting in his waiting room, finally get called in, and as I go in, he said, oh, how are you, Ray? Long time no see. How's things going? I said, all right. I must have looked a bit startled. He said, you wonder why I remembered you? And I said, yeah, well, you've got my details in front of you in your hand. He says, no, I haven't read them yet. He said, I remember you because of your mouth. When they cut me from ear to ear and took this ear off and sewed it all back up again, there's a little button under here where all the bits skin met. And when I would eat something like dry biscuit or bread, this thing would drip water down my neck. So when I went in and seen him the first time, I mentioned this, and he says, that's where that saliva gland went to. What they did is they took all the glands out and left one saliva gland over here somewhere, just so I get a little bit of moisture. And if you want to shut me up, just give me a dry biscuit and I can't talk. And apparently one of the saliva glands got caught in this button. So I said, so anyway, he said to me, so I remember that saliva gland you lost. And he said, yep. So he said, I had a young guy, 16 years of age, who was born with no tear ducts, and he couldn't go out and play outside because he had to keep moisture in his eyes. And he said, I thought, Kelly and his tear duct, his saliva gland. He said, I took a saliva gland out of the little bloke and put it in where his tear duct should be, and he's as good as gold now. So that is something good which came out of my operation. Now, if any of you belong to other organisations, we're very happy to go along and talk to them. And don't forget to pick up the handouts up the back on your way out. We also have a short survey which we've dropped on each seat. If you wouldn't mind, it's not compulsory, but if you wouldn't mind filling it in for us. Now, any questions? Yes.
What's so significant about the cut-off date, age of 74? I think everybody here probably heard of that. So about the tests.
Oh, I'm not a doctor, but my understanding is, I can only go by what was told to me. When they found the polyps with me, it takes 30 years to turn into cancer that'll do you any damage. 74, 30 years, 104, maybe it's not worth having the test. I don't know for a fact.
It depends on family histories here. If you've got, if you're say 70 or 75, if you've got a terrible family history of bowel cancer and if you have polyps already removed and you're in good health at 75, then you probably should keep going at least until 80. If you certainly if family members live that period of time. If you don't have family members living a long time, then maybe there's not quite so much the necessity for doing it. But look, you can't always be sure about that. If you're 75 and in great health, then you'd have to presume you may live another 10 or 15 years as long as you don't get cancer. But look, I've had patients who had colonoscopies up until their early 80s and developed cancer 5 to 6 years later when they were clear at 82. So I think you've got to play it by ear. Your doctor would have to advise you there. But The other thing about colonoscopies, and that is the older you become, the more risky they become because of the fluid that you drink beforehand. And it can cause patients to collapse and even become quite disorientated. So again, it has to be done more cautiously. If you've got symptoms at 80 and need to have a colonoscopy, it's often better to go to hospital overnight, where they give you the prep and they just keep an eye on it. So that with bowel cancer, that's the approach you would adopt.
And that will be my answer to anyone else who asks that question. Any other questions? Well, thank you very much for your attention.
Thank you, Anna and Ray, for that presentation with the high incidence of cancer in our community, those figures you gave us. I think I'm pleased that Northbourne Probus have been able to give you a forum for getting your message out to the community, and hopefully it will expand beyond Northbourne Probus by your attendance, the attendance of our members today. Ray, you're unbelievably well qualified to give the talk, having been a survivor of so many types of cancer. I think your experience is wonderful to hear. And being a fellow Probian involved in this community service, I think all of our members would salute you for the community service you're doing. Thank you for that. Not meaning to be trivial now, but where is Scottsburn?
Scottsburn is between Ballarat and Geelong. You may have heard of Buninyong, where they have the road cycle race. Well, over the top of the Buninyong Hill is Scottsburn.
Excellent, excellent. I'm sure our knowledge has expanded dramatically with that answer. So, members, please express your appreciation in the usual manner. Finally, we do have some, you said beer was a psychological medication in one case. We do have a couple of bottles of red which might perform the same role. Don will give it to you.
Red wine is good for you. It's moderation.
I haven't had a drop since I lost an esophagus. Thank you very much.